Sumayya, it's nice to have you around once again to talk about this. What are the key strategies being proposed now to actually strengthen Africa's health systems?
Hello, Lekon. Now, of course, experts here who are over 250 health experts in attendance of the summit say that they are focusing on prevention, stronger detection tools, and sustainable financing. Specifically, they decided to give details on this declaration, that's Dakhla declaration, saying that come 2026, the main aim is to make sure that they push towards prevention of a lot of communicable diseases that are happening, in the continent of Africa. Also, they said that 2027, the main aim is to push for AI and also data collection, saying that without possible, solutions and possible results or knowledge of what is going on in Africa, they cannot find solutions to that. From 2028, they're going to push more on the PPP, that's a public and private partnership, in order to bring more financing to the health sector so that Africa can achieve that particular health sovereignty. And also come 2030, that would be the major push, and hopefully, because the people here were hopeful, saying that they are hopeful that the sovereignty that Africa needs in terms of health in general will be achieved. So for them, it's all about stress for the health insurance across Africa. There was a conversation about how, even though we know that basic health insurance coverage has been improving, the numbers have been increasing, there is still a lot that needs to be done in terms of service delivery. So that basically is a rollout strategy of what it's looking like in terms of achieving health sovereignty for African continent.
It must have been a very robust conversation going down in Dakhla. I remember you talked about funding during our first conversation. So how are experts linking financing? Let's tie that to governance now as regards universal health coverage.
Yes, in terms of that, they say that, like I pointed earlier, financing cannot work without particular solid data. So for them, they say that accurate data collections and protection is essential, especially when it comes to strong governance. Now, of course, we know that when it comes to data, as much as we want to rely on private organizations to be the one to do that, they are calling on the government, particularly, they say we need to play a particular kind of politics in order to achieve that. And this is something that cannot be done without the government. They say, of course, it's a serious consideration. So considering, they pointed out that 15% of health data, rather health allocation of the GDP, saying that as much as this is something that has been made public, that if at all we want to achieve the universal health coverage in the world globally, then there has to be that 15% of GDP going to the health sector. But then a lot of African countries, the majority, are still not able to meet up to that. So as much as we know, particularly the problems, the solutions, we are not really putting the right solutions in order to achieve that. So they are calling on, government of every African state to put their foot forward and link up with, African countries and, of course, Morocco, who is leading this delegation in order to achieve the sovereignty come, say, 2030. According to the speakers here, they say that this is not something that they are seeing, on the long term. So the point is by 2030, there should be a level of health, sovereignty in Africa where Africans don't need to go out of this continent in order to secure great health, great medications, great services, great knowledge in terms of health.
All right, thank you so much, Sumayya Abubakar. It was nice having you detail this for us on the news.